Knock, knock. I'm going to come in and I'm going to wash my hands. And hi, how are you today? My name is Alyssa and I'll be your nurse. We're going to do your physical assessment, which should roughly take about 20 minutes, okay?
Yes.
All right, and first I'm going to have you state your name and date of birth, please.
John Smith, 6'4", 85.
Okay, and his wristband does say John Smith, 6'4", 85. He appears to stated age of 34, and he does not seem to be in any distress. His facial expression is calm and relaxed. His face is symmetrical. His body is symmetrical. His posture is really good, sitting in the upright position, and his facial color is matching his ethnic background. His hair has recently been washed and brushed, and his nails were recently cut and perfectly groomed, and checking his capillary refill is less than 2 seconds. He is aware of person, place, time, and situation. There's no slurred speech, no disrupted speech pattern, and he speaks with a normal, calm tone in his voice. There's no appearance of any distress or distress with breathing. He is very good chest symmetry is what I could see in his upright position, and overall he looks really good. So next I'm going to move on to the respiratory and cardiac and peripheral vascular assessment. So for this I'm going to have you please remove your shirt. Okay. Are you ready for this? And the patient appears to be nose breathing. He is not using any accessory muscles of the neck and thoracic cavity to breathe. He is not any respiratory distress, again, I'm noting that. And I don't see any jugular vein distension or pulsation. In order to check that a little bit better, I'm going to have you lay flat with your right side facing me. Thank you. And he has no presence of cough or sputum, so I want to note that as well. So first I'm going to get a general survey of his chest. It is symmetrical. The anterior is 2 times the size of the posterior, which is normal. And he's got hair evenly distributed throughout. His skin color matches his ethnic background. No scars, no bruising, or petechiae, no lesions. The skin is nice and pinkish, and is equal on both sides, and does not appear to have any difficulty breathing. Then I'm going to go ahead while he's laying flat, check for jugular vein distension once again, and he has no pulsations and is actually negative JVD for him. So next I'm going to get like a general feel of his chest cavity, and it is symmetrical, no bulges, no masses. Does any of this hurt? Does it feel tender?
No.
No? Okay, so there's no tenderness, no pain with breathing, and no cyanosis in his fingernails or his toenails. And his toenail capillary refill is brisk at less than 2 seconds. There's no bruising on his toes, no lesions, no bumps, no bulges, negative on peripheral edema, so we can check over the bony prominence while I have him laying flat. And if you did have edema, I would rate that on a 1+, 2+, or 3+ scale. Let's see here. And overall, like, his toes look good. His fingers look good, nice and pink. They're underneath the nail plates. And the temperature I'm noting is normal. There's no like noticeably hot or cold extremities. I'm going to go ahead and just check while he's laying flat. I'm going to check all his peripheral pulses. I did take his apical and radial earlier, and it was regular at 72 with no pulse deficit. So I'm going to move on and I'm going to check those. I'm first going to check the radial bilateral and regular with amplitude at +2. And then I normally have him down to his underwear, but for this taping I'm going to just demonstrate. We would find the femoral pulse here in between his legs, nearest the inner aspect of the femur. And those are nice and regular, amplitude +2. Next would be popliteal. Rate is regular, amplitude is +2. And then I'm going to move on to the posterior tib. Then I'm going to note that their regular amplitude is +2. And then dorsalis pedis, rate is regular, amplitude at +2. So that is good. There's no pulsations in his chest. There was no crepitus when I felt over the chest. So all looks good. Now I'm going to have you actually sit up for me so that I could get a look at what should I call it? Get a look at your cardiac. I'm going to demonstrate the 5 cardiac landmarks. Okay, so here I'm going to demonstrate the 5 cardiac landmarks. Here I have my aortic, which is the second intercostal space on the right, pulmonic, second intercostal space on the left, and the third intercostal is going to be Erb's point. And then we're going to move to tricuspid in the 4th intercostal space nearest to nearest to the sternum. And then we're going to move on to mitral, which I would listen to when I auscultate. I would listen to for 1 full minute. And all is good. Normal rate of breathing, normal depth, good chest symmetry. And I'm going to now I'm going to auscultate the lobes. After I quickly see the rise and fall of the chest, the symmetry of his breathing. Okay, so I'm going to take 2 thumbs here and pinch in, keeping my thumbs 3 to 5 centimeters apart. And you're going to take 1 deep breath in for me. All right. Okay, normal chest expansion. And I would also perform this posteriorly. And next I'm going to listen to the 5 cardiac landmarks. I'm going to auscultate the landmarks, and then I'm going to auscultate the lobes of the lungs anteriorly. So here we've got aortic, pulmonic, Erb's point, tricuspid in the 4th intercostal space. Okay, and then mitral. Alright, good. I'm definitely note that in the mitral and tricuspid, those are typically where we'll hear the S1 sounds because that's the apex of the heart, and at the base of the heart up here in aortic and pulmonic and Erb's point, usually that's where we hear like S2 sounds. Okay, and now I'm going to auscultate the lungs. This will be my right apex of the lung here. Deep breath in and out. Okay. And this still on the right side, upper lobe. Breathe in and out. Okay. Breathe in. Breathe out. Breathe in. I don't note any crackles or wheezes present, no rhonchi, no difficulty breathing. Rate and depth is normal and clear. All right, and can you lift your arm up, please, so I can check this laterally on your right lobe? So mid-axillary. This is the upper. I'm sorry, yeah, this is the upper up here. Breathe in. Clear. And this is about the middle portion of the right lobe. Breathe in. Good. No crackles, wheezes, or rhonchi. And then the lower. Breathe in. Okay, arm down and turn to your side for me. I'm going to do the ladder technique posteriorly. I'm going to have you kind of, can you move this way a little bit for me? Thank you. Okay, I'm going to start up here at the apex of the left lung. Breathe in. Good. Moving down from the same side. Good. And then. And then. And out. Breathe in. And out. Breathe in. And out. Breathe in. Deep breath. And out. Breathe in. And out. Breathe in. And breathe in and out. I'm at the base of the lungs at this point. Alright, sounds good. And I was listening closest here to the spine. So we're in between vesicular and brachiovesicular. Brachiovesicular is more inside that area of the spine between the scapula, and then that is the brachiovesicular, and then outside of the scapula would be the vesicular sounds. So all sounds good and clear. Very good. So next we're going to check the abdomen, okay? So I'm going to need you to lay down for me, please. Okay, so with this, first I would do a general inspection of the abdomen. And he does have hair evenly distributed throughout the abdomen, no scars, no bruising, no striae, no petechiae, no Cullen's sign, which appear like bruising around the umbilicus. Umbilicus is midline. No gray Turner sign on either flank. Skin is pink and matches with ethnic background. And I want to also note that there's no cyanosis and no distress and no visible pulsations in his abdomen. The contour is pretty flat and normal. He is relatively thin, but not very thin where you would see any scaphoid, which would be like indentation right here in the middle and then going to his stomach, none of that. So that is normal. I'm going to auscultate before I palpate, and I'm going to work from the right lower quadrant clockwise. So right lower, and I'm listening to 1 full minute in each quadrant. Okay, and that sounds good. And I noticed also with going back to the breathing, there were no heaves or lifts when I palpated the thoracic cavity. Just wanted to not forget that part. Now I'm going to go on to generally palpate, and I'm checking for bulges or masses and tenderness. Does any of this hurt to you?
No.
Okay, and then I will move on to also note that if I was listening to his bowel sounds and I wasn't hearing anything, I would also continue to listen for 5 full minutes before noting that his bowel sounds were absent. But his bowel sounds were normal. So now I'm going to lightly palpate. And does any of this hurt?
No.
So no tenderness and no pain. And then I'm going to move on to deep palpation. Does any of this hurt?
No.
And I'm lifting my hands with light and deep palpation. And everything seems symmetrical and where it should be. No masses, no bulges or tenderness, no redness, and no lesions. Okay, so let's see what else. And I think we are good. Yep. And he also did not use any accessory muscles to breathe. There was no retractions. And everything is kosher, so we're set. Thank you for watching.